There's growing concern about the number of children in the UK being prescribed medication to combat attention deficit hyperactivity disorder. ADHD, as it's known, includes symptoms of anxiety, intolerance and an inability to regulate emotions. A new study has found an increase in prescriptions in the UK of almost 57% between 2005 and 2012. The research also found large rises in prescribing across Europe and the United States. But some parents and doctors worry that drugs are being offered as a quick fix and that long-term issues behind ADHD aren't being effectively addressed. Our correspondent Sean Lloyd reports.
Well, my friends, they know I have ADHD and they know I take medication, but I don't think they really know fully how it is to be like this.
13-year-old Dylan Piper was diagnosed with attention deficit hyperactivity disorder, which is a mental health condition, when he was 6. He struggles to concentrate, and that can lead to him being disruptive. His mood swings are controlled by medication, so he can continue to go to school. But his family are concerned about whether taking drugs is the best solution to changing his behaviour in the long term.
If I was able to do or give him anything else, I would in a heartbeat and not have him on medication. However, right now, we don't have any other option.
The use of medication for children like Dylan is the focus of a new international study. The United States has the highest prescription levels, but the report shows that the UK is catching up. The rate here has increased by almost 57% over a 7-year period. This report tells us that more children and young people are being prescribed medication for ADHD and suggests that some may be taking the drugs for longer periods of time. But it doesn't tell us exactly why more drugs are being prescribed in the first place. Doctors like Professor Alka Huja have to follow strict guidelines surrounding the diagnosis and treatment of ADHD. Medication is effective, but it isn't advised as the first option, except in the most serious of cases. She says professionals can feel under pressure to deliver results quickly.
As a society, I think our tolerance is going down. As far as behaviour is concerned, we want instant fixes. So, there is a lot of pressure to often medicalise behaviour.
So how are they going to work together?
Play therapy is one alternative to medication. It can help children gain the coping skills they need. Occupational therapist Neris Hughes was so frustrated by the lack of choice offered to her son Oakley and children like him, she set up her own therapy centre to help children with ADHD.
It's much harder to get funding for a child to like themselves than it is to get funding for a medication that stops a child punching their mum 10 times a day. Is the truth. But the long-term impacts of the medication are still not fully uncovered, whereas we do know that children that have gone through successful treatment packages do come out feeling much better about themselves and having a much better way of relating to their world.
Dylan's family are investigating other ways to help him alongside the medication. Increasingly, parents and health professionals say they are concerned about the condition becoming over-medicalised. Sean Lloyd, BBC News.